Let's discuss diagnosis according to 12 regular channels. The overview. The channels and organs form a holistic structure where changes in one will affect the other. This means that the organ imbalances can manifest with a disruption of the associated channel and vice versa. Although organs and channels are inextricably linked, there can still be and often are imbalances in one without these manifesting in the other. Diagnostically and therapeutically, it is therefore most appropriate to diagnose them separately and use diagnoses according to zangfu organs to diagnose organ imbalances. Channel imbalances can arise when a channel is invaded by exogenous pathogenic qi, when there is a repetitive movement or strain of a limb or joint, when there is a physical trauma, and when there are imbalances in the channels related zangfu organ. The diagnosis in relation to the 12 regular channels is most commonly used in the diagnosis of musculoskeletal problems and B syndromes. The diagnosis in relation to the 12 channels focuses on which channels are affected. Channel diagnosis is, by definition, an exterior imbalance in relation to the 8 principles. The channel diagnosis can relate to an interior zangfu imbalance. Diagnosis will be based on where in the body changes have manifested themselves. These changes should be seen in relation to the internal and external pathways of the 12 regular channels. It is important to determine whether there is a deficient or an excess condition. Palpation of the channel is indispensable in this process. The muscles along the path of the channel should be palpated to see if there are any changes in the tissue. Changes in the tissue could be the presence of nodules, graininess in the tissue, sponginess, tightness, hardness, softness, or weakness. There can also be changes in the temperature and moistness of the skin along the channel. The size, depth, and hardness of any changes along the path of the channel are also important diagnostic factors. Tightness, hardness, and tension are usually indicative of an excess condition in the channel or its associated organ. The more superficial the hardness, the more acute the condition is likely to be. Softness and weakness in the tissue along the path of the channel is a sign of a deficient condition in the channel or its associated organ. If there is a deficient condition, the palpation will feel more pleasant for the patient than if there is an excess condition. Cold and blood stagnation can manifest with nodules that are hard with clearly defined edges, whereas phlegm and dampness nodules will tend to be smoother and more slippery with less clearly defined edges. Longer, more stick-like nodules can also be felt along the path of the channel. If the stick-like nodules are bumpy and lie along the channel, it is a sign that it is a chronic condition that can be difficult to treat. Stick-like nodules that can be felt transverse to the path of the channel are typically acute or are due to stagnations of qi and are thereby easier to treat. If the patient reports sensation of numbness while an area is being palpated, this can be due to phlegm blocking the channel. Additionally, individual acupuncture points along the channel should be palpated to see whether there is a tenderness or pain or whether the patient feels the pressure is pleasurable or gives some form of relief. There can be changes in the temperature of the skin along the channel when there is heat or cold in the channel. Visual observation of the channel is also important. Heat in the channel can be manifest with redness along the channel's path or with spots, pimples, or other skin changes. Observation of the joints is particularly important. This is because it is at the joints that qi sinks deeper into the interior or rises up to the surface. This means that it is a place where pathogenic qi tends to accumulate. Problems with sense organs and the body's orifices can often result from imbalances in the channels rather than the sound organ that is controlled by. Excuse. For example, many problems in the ears are due to imbalances in the small intestine, gallbladder, or zangfu channel, and not the kidney organ. It is important to remember in diagnosis according to the 12 regular channels that it is not only the channel main force that is of relevance. The channel's internal pathway, the muscle channels, the loop connecting vessels, and the pathways of the divergent channel must also be taken into account, as well as the channel's relationship to its partner channel and its extended channel. We have here the table for the excess condition in the channel. There is tenderness, tightness, and tension along the channel, while in deficient condition in the channel, there is weakness in the muscles and connective tissue or muscle atrophy along the channel. For the excess condition, there is tenderness or pain on palpation of the channel, where in deficiency, there is relief of pain or pleasure in palpation of the channel. For the excess condition, there is a pronounced cramping or sharp pain in the joints along the channel, while in deficiency condition, there is soreness, weakness, numbness, or fatigue in the joints along the channel. For the excess, there is red coloration for heat or bluish coloration for cold along the course of the channel, while in deficiency condition, there is pale color along the channel course. For the excess condition, the channel feels warm, while in deficient condition, the channel feels cold. For the excess condition, there is the relevant pulse position is full, while in deficiency condition, the relevant pulse position is weak. For the treatment in excess condition, it is treated with draining needle techniques, while for the deficiency, it is treated with tonifying needle techniques. For the heat in the channel, another table, differences with the heat in the channel and cold in the channel. For the heat, the channel feels warm, while for the cold, the channel feels cold. For the heat, there is redness of the skin, there is pimples, spots, or other red coloration along the path of the channel. While for the cold in the channel, there is bluish or very white skin along the path of the channel. For the heat, there's a pimple, spots, or other red skin conditions along the path of the channel. For the cold, there is hard, clearly defined nodules in the tissues along the path of the channel. For the heat in the channel, there is inflammation, redness, dryness, or yellow sticky exudation from the sense organ or orifices that the channel connects to. While for the cold, there is increased watery discharges from the sense organ or orifice that the channel connects to. For the heat, there is a burning, stinging pain in the sense organ or orifice that the channel connects to. While for the cold, there is a cramping, intense pain in the sense organ or orifice that the channel connects to. Again, for the condition in the channel, there is dark or purple discoloration of skin along the channel. There is also a sharp stabbing pain along the path of the channel. It is inhibited. There is an inhibited movement of the joint along the path of the channel. It is also hard, clearly defined nodules in the tissue along the path of the channel. Thank you for your attention.